Hello, 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 hello. Welcome, welcome. So today I am here at my dentist doing my diabetic oral care, checking on my gums, checking on my teeth, make sure I still don't have any teeth that is decaying and that my gums are holding good and not receding, and having my retainers checked. So I decided to come on for a little bit to talk about the importance of not only taking our medication and exercising, but having our tooth on our gums and our mouth check for gingivitis, early periodontitis, and even moderate to advanced periodontitis. All these things are so important for us to keep a check on. Thank you, thank you, thank you, thank you. Thanks for coming in. All these are things that we need to do, not only as diabetics, but as you know, my focus is on diabetes because I'm a diabetic, and I'm hoping that some of the things that I do will encourage or support what you do. So, again, this dental office that I'm at, Scottsdale Dental Group, oh my goodness, they take care of everything. They do from prosthetics to dentures, fillings, cleaning, cosmetic work. They do everything here. And the staff here, they're so nice. And my doctor, which I hope you guys will meet before I leave, he's just the best. He's just the best in preventative care for diabetes. That's why I just switched to him about a year ago. Hi. Being black, you're funny. No, sweetheart, not BBL. Not BBL. I'm pretty good with my LLL. I'm pretty good with Thank you, thank you, thank you. I'm pretty good with what I have. I'm pretty good with what I have. What happened is I try to take very, very good care of myself as an individual, but also as a diabetic, because when we have chronic illnesses, we really have to pay attention in what we eat, exercising, keeping up with our doctor's appointment. I know medical care is very expensive, but thank God I have good insurance. So next week is my birthday. I'll be 63 next week, and I literally planned this visit because I try to come and see my dentist and my orthodontist every 3 months, and it has worked in keeping my gums healthy. It has worked in keeping my gums healthy. And we're gonna talk a little bit about the care for diabetes. When my hygienist come in, she's gonna talk a little bit about what she does for me. And for today, I'll be getting my gums checked. I'll be getting a deep cleaning, a deep floss. They're going to be flossing, and they're going to be cleaning my teeth, my tongue, massaging the gums, and checking to see if I have any cavities. The last time I was here, which was 3 months ago, I had none. So I also wear retainers. I forgot them today. So normally they would check them and tighten them and make sure everything is going good. They also check my jaws to make sure that my back teeth is aligned, so I'm chewing properly. Welcome, welcome. Thanks for dropping in. Thanks for dropping in. Like for me, please. Like and share and sub. For those of you who have not sub yet, go ahead and sub. Invite your friends over. This is my orthodontal and dentist visit. So one of the things they constantly check for me is to make sure my gums are not receding, because our gums recede with age, but with diabetics, it recedes faster. And when we talk about gum receding, is when the gum shifts and the chewing is hard. So they had me braced for about a year because my gums were not. Jackie Gordon, good evening, good evening, good evening, good evening. Good evening, Jackie. Remember to like for me, Jackie. Remember to like for me. Love your support. So for me today, they're gonna check the alignment of my jaws to make sure that they're still, when I chew, they're coming down the right way. Because not only does it helps with the chewing, it also helps from getting stomach burns. So I get a complete care, mouth care when I come in. I don't think they're gonna do any x-rays today because we did x-rays the last visit. Come on in. This is my doctor.
How's it going, guys?
This is my doctor, guys. He is the absolute best. He spoils me. I think everybody here loves him.
Yes.
So I was telling them about how you took care of my gums and helped me, and you're helping me to maintain a healthy mouth care as a diabetic.
Of course, because it's the direct correlation. Diabetes and oral health go hand in hand, and if you are not taking care of the entryway to your body, you can forget about the rest. And Muriel here is a committed and devoted patient. She is here every day, every 3 months for her appointment. If anything is ever hurting or bothering her, she's taking care of it. She doesn't mess around.
Thank you. He's the best. See my smile, guys? He's the reason I smile from ear to ear. And I was telling them that also brushing the tongue and the gingivitis and all that.
Yep. So your tongue harbors a lot of bacteria that can end up causing more issues long term, and a lot of times patients neglect that, and it's a big organ and it needs to be cleaned. And brushing your tongue at the end of your 2 minutes, just for about 5 or 10 seconds, there is more than enough. But also using mouth rinses that help kind of decrease or eliminate the bacterial load is important as well.
How do they detect gingivitis?
So we do an assessment. It's called periodontal probing. We use a probe that has measurements on it, and what we're looking for is not only the health of the gum tissue, but the health of the bone. So with diabetes, what happens is that the smallest extremities of your body, your fingers, your toes, your teeth, are typically the first things to go due to neuropathy, due to lack of blood flow. So we're checking that every time Muriel comes in to make sure that she has good bone health, good gum health, and that everything, the foundation is strong. Because if the foundation isn't strong, it makes no sense putting a new roof on the house.
Thank you so much, Doc. And believe me, guys, he is so busy, but we have to bond when I come in. Whether if I'm leaving, if he doesn't see me when I'm in the chair, he'll see me when I'm leaving, or if there's an issue, he comes in and he addresses it. And I'm telling you, give the name.
Scottsdale and Shea Dental Group. We're on the northeast corner of Scottsdale and Shea. We are open 5 days a week. Some days we are open till 7. Some mornings we're open as early as 7 to make it convenient for you to get your oral health care taken care of, and to make sure that we're helping as many patients as we can.
And I was also telling them that you're a comprehensive dentist.
Yes, definitely.
Yes.
So we do everything, not only your 6-month checkup and cleanings, but we also have surgeons in office to do root canals, to do implants, to do wisdom teeth removal. We do cosmetic cases. We do partials, dentures, crowns. We have same-day crowns. So very convenient practice. Like I said, here to help you get the treatment that you deserve.
So guys, you heard it. I have been to other dentists before, and when I found doctor, the issues that other dentists tell me, oh, it's okay, you're a diabetic, these things happen, he doesn't do that to me. And I'm not just saying that because he's here, because he knows how pleased I am with his care. He looks for everything. He talks about everything. And as I said to you guys before, the staff here, they're professional but warm. Some people can be so rigid as professional. They're very warm here. So what we're encouraging for those of you who lives in Scottsdale, in the Phoenix area, and you can come up, Scottsdale Dental Group It's between Scottsdale Road and Shea. Just go on your website, look at it, and make your appointments. The wait here, I have never waited more than 10 minutes. And if you're waiting, they come out and say why you're waiting. We have someone that we're going through some emergency with. We'll be with you shortly. Very, very, very friendly atmosphere. So I'm inviting you guys. If you need a good dentist, come and try mine.
Awesome. Thank you, Muriel. We appreciate you always, and we look forward to continuing our relationship with you going forward.
Thank you so much,
You're
Doc.
welcome.
So
Okay.
guys, so those of you who are just coming on, I'm here to do my diabetic 3-month check, and you just heard my doctor say how important it is to take care. Hi, Sharon. Thanks for coming on. I know most of you guys are still at work and you're popping in and out, and I also know that some are just watching. So thank you, thank you, thank you. Remember to like and share and sub out this. We all take care of ourselves. But when you have, as I said before, a chronic illness, it's something that should be taken seriously. And not only should you take your care seriously, but find a doctor that understands your concerns, and that will listen to you. When I came in first, I told him what was my concern. I did not want to lose my teeth. I did not want to lose my beautiful smile. He found tooth that needed to be taken out. He took them out. And as he said to you earlier, not only did he take them out, but he put in crowns that you could never tell they weren't mine. So taking care of your oral health is just as important as taking care of your medical and mental health. Okay, so now we're gonna go into my cleaning. Somebody says your tooth don't look like it needs cleaning. Somebody just text me your tooth don't look like it needs cleaning.
Oral hygiene. Okay, Ms. Muriel, I'm going to put you back. I'm going to take a look. I'm going to do your exam and your periodontal assessment there.
Okay, guys, so now he's going to do...
And I'm going to slide on some glasses there. I'll help you out with that there.
So here I am, guys.
Relax for a minute. We always do our oral cancer screening as well, and that's where we're looking for any lumps, any bumps, any deviations from normal looking tissue. We do it on everybody because anybody can be susceptible. So remember, we want to hear 2s and 3s, okay? That means healthy gum tissue, healthy bone structure. I'm going to start in your upper right here. 2, 2, 3. Number 2, 2, 2. 2, 2, 3. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 3. 3, 2, 2. Number 14. 3, 2, 2. 2, 2, 3. 3, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 2. 2, 2, 3. 3, 2, 3. Bleeding on the mesiolingual of number 3. 2, 2, 2. 2, 2, 2, 2, 1, 2, 2, 1, 2, 2, 1, 2, 2, 1, 2, 2, 1, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 3, 3, 2, 3, 3, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 2, 3, 3, 2, 2, 2, 2, 2. So Muriel, everything's looking really good.
Except we're at the bridges,
Bridget,
right?
yep, in that same spot right back there. Lots of information right in this area back here, okay? So when we're using our different tools and toothbrushes and flosses and water picks to make sure we're keeping that area clean, I'm gonna let Emily know that that's an area that I would like her to really, really flesh out for you today.
Yeah, I feel it when I floss.
Yep, and that's the thing is something that I know of you is that you're very in tune with your body. You know when something is not 100%, and you are diligent at keeping up with that. So, if I tell you something, you do it, right?
Yes, I try.
Yes, and not only that, but further to that, you don't ignore signs and symptoms.
No.
A lot of times, patients will just ignore that, or will almost push it to the side or sweep it under the rug. But you are somebody that takes things head on, and that's because of your desire to not want to lose any more teeth. So, and you understand the correlation, you understand, and you appreciate good oral health. So, I'll let Emily know. Any other questions for me?
No, just right there. And do I have to eventually remove this and put another one? We spoke about that once.
Yes, I mean, so I feel like it's starting to chip off as well a little bit. Like this seems really rough over here. How old is this one now again?
About 4 years.
Yeah, see, that's the thing. That's so young.
Yeah.
Let me do this for you. Let me see if there's any exclusions with your insurance on it, because I don't want you to.
No, it wasn't on this insurance.
Okay, perfect. Okay,
No.
so let me see what I can work out for you. Okay.
Okay.
Awesome. Any other questions for me?
No,
Perfect.
thank you.
You're welcome. I'm gonna sit you back up a little bit here.
Okay.
And I'll let Miss Emily know that you're ready.
So guys, that's the examination, and now we're going to go to the cleaning. But I have veneers over here, and I noticed, that's why I made the appointment, I noticed that when I flossed, those veneers, they shift a little, and they're not supposed to shift. So he found a little bit of inflammation there, and that could be irritated from flossing, because I floss a lot. That could be from flossing, because I floss a lot. So he's going to look into possibly if my insurance will cover it, which I think they will, because they covered it before 4 years ago. Normally they last longer, as he said, but as a diabetic, again, things are never the same. Things change every year or every 2 years, things change. So we'll see where we go with replacing them. We'll see where we go with replacing them. Hey guys, did you see what Being Black on Earth said? He thought I was coming in for BBL. He thought I was getting ready to do a BBL. Did anybody see that? Hi Sharon. He said he thought I was coming in for BBL. So for those of you who are watching who are not in the chat, welcome, welcome, welcome. Yes, I tend to be very private, but since I became a content producer, I decided that I'm going to use some of the things that I do in my life as a diabetic to encourage and support other diabetics. So this is the reason why I'm doing this, and I'm just happy that my doctor is so supportive. He is so supportive. So we'll see. You'll get to see how they clean it, and not the ooky parts, just the, speaking to the hygienist, because that was my dentist, who is also orthodontist and who is also a cosmetic surgeon, a cosmetic surgeon for the mouth. And he shared before, so now the hygienist, she's gonna come in and she's gonna share what they look for and when it comes on to cleaning the diabetic mouth. Okay? This office is so busy. They're so busy here. They're always busy here. And when I found out that they open at 7 in the morning and they close at 7 to, as he said, 7 to 8 at nights, and that's because they have a huge cosmetic center here and oral surgery and everything here. And for dentists, that's very long hours. very, very long hours, but they're really, really, really good if you have, I think this dentist, if you have an emergency like a toothache or anything, you can get them. That was one of the things I liked about them. I don't get toothaches a lot because I really, really take care of my tooth. But one of the things I liked about him, his office, he's the owner for the business, is that they take you on an emergency call, they meet you here and they treat you. When I found that out, I was like, wow, what a good service for the community. You know, to be able to reach a dentist that brings you in and take care of it, because here, from I've heard, allegedly the emergency rooms here don't do any type of dental care. I think they just make sure that you're okay and give you some pain meds and send you home to find a dentist. So it's so good to know that he is one of the practices that opens to facilitate emergencies. And he's a certified orthodontist, certified cosmetic dentistry, and some other specialty. He does all the specialties here. So share, guys, share, invite others in. I know it's a little early. And quite a few of you guys who are always in the chat are at work. Plus, I didn't put up a notification on Facebook because when I came in for my visit, I asked when I came in if I could go ahead and vlog about my care. So I didn't prepare because I didn't know if it would be able to done. So as I sat in the chair and I asked them, they said they would love to talk about the work they do here and the work they do on me. So I appreciate that. So there was no notification given. So those of you who are on, could you share for me, put it on your page? I appreciate that. So as I said, I'm waiting on the hygienist. She's right next door. I can hear her finishing up. So she's right next door. So today I didn't need an x-ray because Doc found the problem that I had. It wasn't anything major. It's just one of the veneer is, the gum is pulling apart from it because of the flossing. It got irritated. So he's either going to replace it or treat the area that's irritated. So I'm waiting now, as I said, for the cleaning. And then he'll tell me whether he's going to take them out and put new ones in. But they're not hurting. They won't fall out. It's just probably I need to floss a little less that area. Probably I'll need to floss a little less that area. But I made the appointment a couple weeks ago because I felt a little different when I flossed there. I felt a little different. It felt hurt. It hurt and it's not supposed to hurt. I've had them in for years and they've never hurt. So, and one thing with diabetics, once we get a bruise or once something just barely touch us, we can either get swelling in the area, or even on my leg, I hit my leg on my bathroom door and it's still very, very tender. That's the thing about diabetics. Or ability to form infection is so high. It's so high.
Well,
come on in.
hi, how are you?
I'm good. Oh, you're my hygienist?
No, not your hygienist.
Oh.
No.
I'm like, what? Oh, you're coming for the money?
I know. Like, who are you? No, Dr. Marlis wanted me to go over that bridge that he was talking to you about.
Okay,
Yeah.
so guys, I think they're gonna replace my bridge. They're gonna looking into replacing my bridge because it's too tender under there.
So pretty much for...
Yeah, I had him look into that your insurance for you.
I don't know if I submitted the new one.
The United Healthcare?
AARP.
Yeah, I think
Okay,
that's the one.
alright.
Yep, this is the
Okay.
one that we have on file. Yep.
Okay.
Yeah, so pretty much for the bridge that Dr. Morales is talking about,
Uh-huh.
this will actually be your copay after your dental insurance.
You're kidding?
Yeah, so in the middle is what your dental insurance is covering.
Yes.
And then this would be your out-of-pocket after dental insurance.
That's not bad at all.
Mm-hmm.
So guys, it's in the thousands of dollars, but my insurance will cover it. All I have to do is pay a copay. And this is what I'm saying, you know, taking care of ourselves medically and holistically, really, from the medical to your dental to your eyes. I have to go to a foot doctor, and I'll let you all see that. Thanks for coming on, guys. Thanks for coming on. Thank you, thank you. Like and share. I see a lot of people jumping in and out. I know it's early. So I have to see a foot doctor. I have to see cardiologists. I have to see eye doctors. All of that, you know, as a diabetic. And as I said, next week, Wednesday, I'm 63. So the older I get, is more concern I get. And I'm very intentional about how I take care of myself. Very, very intentional about it. So I did my eyes a couple weeks ago. I am doing my ears now. They did my ears also. Yes, got to check the hearing. Got to make sure there's no fluid back there. Now I'm doing my mouth, and I'm gonna do my feet next because my birthday's coming up. And whenever my birthday's coming up, I always make sure I take care of all these things so I know what I'm looking into. Because the older I get, I don't think it's gonna happen because I'm so proactive with my care, but it can happen where all the nuances of diabetic just heat you up.
Is this something you wanted to take care of today, Dr. Caprep, or is this something you want to schedule for?
Let me schedule for that
Schedule?
because I might be going out of town.
Got it. Okay. Did you want to schedule right now, or give us a
No, I gotta check when I'm finished.
Okay. Yeah.
Yeah.
Did they finish up the cleaning then?
They haven't started.
Oh. Wow.
That's why I thought
You're like,
you.
wow. Got it.
I thought it was you. That's why
Okay.
I thought it was
Okay,
you.
then I'll just have this printed out when you're ready, and then I'll check it. I'll give it to you. Okay?
Yes, yes.
Okay. I will let them know that way the hygienist can go ahead and start your cleaning. Okay.
Okay, thank you.
Alrighty.
Okay. So yes, guys, I'm on phase 3 now. So they found the problem. They've solved the problem because my insurance will cover the problem. So, you know, it makes things easier. They're gonna take these out and they're gonna put new ones in because they rest the area a little bit before they put the new one in because the gum is too tender. So they're gonna take them out and rest the area and then they're gonna replace it. Welcome, thanks for coming in. Thanks for coming in. Thanks for coming in. Thanks for coming in. I see you guys are jumping in and off, and I understand it's the middle of a work day. Middle of a work day. I'm free today, so I always schedule all my stuff on my free days. Yes, yes.
Up it goes.
So they're gonna take these out. See where it's shifting? It's not supposed to shift, it's supposed to come along with the regular tooth. So it's shifting, so they're gonna take those out and put new ones in. And they're pretty expensive. Pretty expensive, but thank God my insurance covers it. All I have to do is pay my copay. They're pretty expensive, but let me say this too. A good dental office will always have a pay as you go plan. That's when you know you have a good dentist. This office they have a pay and go plan. That every time you come in, you just pay for your visit. They take full insurance, but also they turn no one down. They always give you a method of how to pay if you don't have coverage. Yep. So here is my.
I know. I'm
Doctor
just.
did so well, he did it.
Yeah, I'm Nicole. I'm the assistant. I'm just gonna polish for you before Emily comes in, okay?
Okay.
I'm gonna polish for you just
So-
so you're not waiting around.
Okay. So now I'm getting my tooth polish. So I told you guys it's a whole process here. I don't need this, right?
Oh, you can
Yeah.
keep them on, yeah, because I have this bright light and I don't want it
Okay.
to shine in your eyes.
Okay, so it's a whole process. So now they're gonna polish me. First, the doctor examined my gums, as you, those of you that saw. Then they found a problem, so they're gonna fix the problem. So now they're gonna polish me and then brush me.
All right. So this stuff just gets off all the soft plaque. Sit you back a little bit more. All right, chin up just a little bit. Thank you. And then go ahead and close down a little bit. There you go. And then turn towards me a little bit. There you go. And you can open a little wider. All right, you can close and spit.
Is that a lot of plaque?
What was that?
Is that a lot of plaque?
Let me see. I actually don't see a lot, to be honest.
Okay.
Yeah, so that looks good. Usually on the back sides of the teeth is where you can tell, but I don't see a lot. And close and spit again. And then check the bottom. Yeah, your bottom looks good too, and that's usually where people have a lot of plaque as well. Yeah. Okay, I'll give you a rinse now. And then open a little wider. Thank you. release it. Do you feel any more grittiness, like you need another rinse?
Yeah, a little
Yeah,
bit
a little
more in
bit.
the back. Mhm.
Is that better?
Mm-hmm.
Okay. I'll go
So
ahead
could
and-
you just tell them a minute what you did?
Yeah, so I used this polish here, which is basically the Profi polish. It gets off rid of all the soft plaque. That's what we use with this little Profi angle here. And then the hygienist, she'll come in and she'll get any of that harder tartar or hard plaque that can't come off with that. That's what she uses that Catatron for. And that goes in a little bit full of gun lime if necessary to kind of clean up all that hard stuff that we can't get with at-home brushing or with soft plaque removal through a polish. And then I'm going to floss. Here. Just got your bridge here.
Yeah, that anytime.
Yeah, that I know that one can happen.
Mm-hmm.
The front teeth, that happens. Okay, awesome. One more.
And how often would you recommend flossing?
I would say at least once a day. Yeah.
Okay.
Some patients like to do it.
Twice.
Yeah, some patients like to do it after, like, they eat or twice a day, morning and night. Flossing is probably the thing people have the hardest time sticking on a routine with. So at least if you do it once a day, that's good. And if you are having a hard time getting a good routine of started with flossing, those floss picks are a good idea because they kind of make it a lot easier, and at least that's something. Of course, the string floss is better. You can get a lot more of the plaque that gets stuck in between your teeth, and you don't have to do it as much damage to your gum as with the picks, which can happen if you're too rough. But at least that's doing it. Like, that's better doing something than not doing anything at all. So, and then with bridges too, I'm gonna get a threader out so that you can clean underneath your bridge with that threader. That's the best way to get under there. Alright. And open a little bit. Thank you. There we go. All right, you're all done with me, so I'll go grab.
Can I have another rinse?
Oh yeah, of course, yeah. Better?
Yeah.
Okay, I'll go grab the hygienist, okay?
Okay.
You want me to sit you back up?
Yeah, just a little bit till she gets here.
Just like that's good?
Yeah. So okay, guys, that's phase 2. That's phase 2. Polishing and cleaning. Now she's gonna get the hygienist. Thank you guys for watching. Thank you, thank you, thank you. Getting my diabetic oral care. Getting my diabetic oral care, which is, as you heard, every one of the staff members said, so important because our bodies and our system goes through so much that we can't take it for granted. We can't take it for granted. And I hope that by sharing my experience, it will encourage you and be a mode of support for you as a diabetic. Now, one of the biggest obstacle in getting, especially dental care, most insurance don't carry it. I am grateful my insurance carry full dental care, the full care, tooth care, dentures if I need them, which I don't, thank God. Bridge if I need them. Um, the retainers, they pay for everything. I'm so glad I have it. So I realize, and I don't take it for granted, that in getting this type of specialty care, it costs money, because a bridge alone can run you up to $6,000. And getting your tooth deep clean like I just did can cost hundreds of dollars. So I recognize that. But for those, again, for those of you who need the care and say, I don't have insurance, find a good dentist that take a payment plan. There are private insurances out there also that you can apply for in your dentist's office to make sure you're taking care of your oral health. Making sure you're taking care of your oral health or physical health or medical health. I had my the care that I have, I've had it done in the last 3 months, and it's so important to have good oral health. I always tell my kids when they were growing up that once you start smelling your breath with that foul, I'm not talking about morning breath, and there's some morning breaths that I work at a hospital, so once you start seeing a little bleeding on the gum, don't say I brushed too hard. Your gums are not supposed to bleed. That's a sign that something is wrong. That's a sign that something is wrong. If you're eating and you're chewing and you're not chewing, it's hurting, it means that something is wrong. Visit your dentist. Visit your dentist. Visit your dentist. As I said, I didn't send out a notification for, so people can come on. Thanks to those who are on, who got their notification. But I didn't send out anything on Facebook or Twitter or anything, because I did not know. I didn't want to ask them on the phone. I did not know if my doctor would have permitted cameras in the office. But I'm grateful that he does. So just share it out to folk that maybe this can assist someone to know what to do as a diabetic when it comes on to oral care, and finding the right doctor. Not every dentist does diabetic care, so making sure you find someone that does it properly, not just brushing your teeth and sending you home, but someone that does it properly. So finding a dentist that works with you and listen to your concerns. I am so blessed that I have a lot of providers. I have a lot of medical providers, and they all listen to me. When I come in and I say, listen, I'm feeling this, I'm feeling that, this is not normal for me. So, talk to your dentist. Talk to your dentist. If you're afraid that when you get there you'll forget what you want to discuss, take a note of it. Write it and carry it with you and talk to them. And that's also a part of good care, when you can talk to your provider. So on the last phase. I am on the last phase. It takes about, when I come in, not every time, but like now I'm on the last time I did it was, I want to say probably December, either December or January. So everything looked good at that time. It was like a 20-minute visit because it was just brushing and going. this time I felt a little different in my veneers. So he was concerned about that. So this visit might take about an hour, but normally it's like a 20-30 minute visit. But because he has to check so much and it's taking a little longer. But normally it's a 30-minute visit. Normally it's a 30-minute visit. I was gonna go on and come back on when she comes in, when the hygienist comes in, because as I said, every room is busy here. Every room is busy, and there's quite a few rooms here. But I don't know how to put it back together. I don't know how to cut and paste it back together. So I'm going to hang on to see how long she comes, so you can hear what she does. And remember, good dental care is not just for diabetics. Good dental care is not just for diabetics. As the dentist says, it's for everyone. But especially diabetics need to really be vigilant about taking care of their mouth.
Hey,
I am good. Here's my hygienist.
Hi.
Here's my
I love that you're
hygienist.
preaching about dental care in here.
Yes.
It's my favorite.
See, guys, I told her they're so sweet here. Yeah, find a dentist that, an office that you can talk to them and have a relationship with them. That's what helps with good care. Don't you agree?
I agree.
Yes.
It's-
This office is like, when you come in here, it's so comfortable. Yeah.
We try to make bonds with our patients
Yes.
and make sure we know you and what you need. And yeah.
So tell them what you're going to do now.
So now we're gonna start using my ultrasonic scaler. So I'll be using an antibacterial irrigation for her, which will help flush out that bacteria, the pathogens, get you all cleaned up, remove all the plaque and tartar that can cause diabetes to spike. So we're gonna make sure she's clean and good to go.
Yay! And I'm not going to show you all the gooey stuff, okay? I'm going to keep the camera on her. She's cute.
Oh, thank you. All right, give me 2
The
seconds.
baby's good?
Baby's good, yeah.
Oh,
7 now.
7.
It makes me sad. Too old.
So she's gonna use what was that thing?
So it's an ultrasonic scaler.
Ultrasonic scaler that
Yeah.
really disinfects the mouth.
Yep, gets
I
all
love
that
it.
bad stuff out of there.
I love it. I don't have a problem with my breath, but I love it. Because it's not just for the breath, right? It's to clean out the gums and
Yep, to kill that bacteria that causes the gum disease, the inflammation, that kind of thing.
yeah.
Yeah, because when you're diabetic, did you tell them the link between diabetes
You can
and?
clarify.
So whenever you have diabetes, and your blood sugar levels are off, so if your A1C isn't where it should be, it actually feeds and helps that bacteria to grow. It causes more plaque and tartar in the mouth. It causes that bacteria to take over. So you're at a much higher risk for gum disease.
Hi, Miss Wendy. Welcome, welcome. Hi.
Yeah, you're
Long
at a higher
time.
risk for gum disease. And same thing, it goes hand in hand. If your gum disease is out of control, it makes it much harder for you to control your A1C.
And that
so
is so true.
it goes hand
In my
hand.
case, it really helps me to keep my numbers down. I know. So glad to see you. So glad to see you, Miss Wendy. So I'm here at my dentist doing my 3-month checkup and hygiene care on my gums and making sure that my oral health is okay to help to decrease, as she says, my numbers, because they go hand in hand. If you don't have healthy mouth, your numbers don't. It doesn't help your numbers.
And not only does it put you at a higher risk for diabetes, but you're twice as likely to have a stroke or heart attack. The same plaque on your heart is in your mouth. It puts you at a higher risk for Alzheimer's and dementia. So there's all different types of things that you just don't want.
Yep, your mouth is the gateway to your health.
That is.
Remember the dentist said it, your gateway to your health. Yes, Miss Wendy, yes, I'm a diabetic, as you guys know, and I'm bringing you on my journey for my care.
All right, we ready to do this?
Yeah.
Awesome. I'm gonna put this right here for you. Whenever you need that irrigation out, just close down. If anything hurts or bothers you, just let me know. Is that okay so far? Okay. I do, thank you. And I have you turn towards me. Perfect, thank you. Back to center. Yep. Right there, beautiful. Showing them all my bad posture right now. Go ahead and close. There we go. We're gonna take a break from that. Doing okay? Yeah.
He's gonna take that out. You think it needs to come out and replace?
The bridge. Yeah. You turn towards me. Beautiful. So I guess I could talk about some of the best home care tools to have at home. Have you talked to them about that at all?
No.
No, so one of the biggest things, go ahead and open, I'll talk while I'm working, I'm gonna turn you here. You wanna have is an electric toothbrush. With an electric toothbrush, you're gonna get 64,000 brush strokes per minute. With your regular handheld toothbrush, you're gonna get about 350. So if you know you're not a good flosser, you've never been consistent with it, having an electric toothbrush is one of the best tools you can have at home to make sure you're keeping all that plaque and tartar under control. Of course, getting underneath the gum line with either floss or water pick is super important. I find water picks are really easy for most patients to use, very user friendly, and they're going to go down deeper into those deeper pockets than what your floss can get. So getting a water pick and using that on a daily basis is super beneficial as well to make sure those bacteria aren't colonizing underneath the gum line. along with coming in every 3 months, like she said, for your cleaning if needed, 3 to 6 months. One of my favorite mouth rinses is Closis. It helps neutralize the pH balance. And the bad bacteria hates, or loves, I should say, an acidic environment. So if we can use a mouth rinse that's going to help neutralize that, it actually helps kill more of the bad bacteria and keep more of the good. So Closis is a really good mouth rinse for you to be using at home. Go ahead and open. We'll start on the bottom when you're ready. Go ahead and click.
It's about what can cause stain on the teeth. Can you talk to me about that?
Yeah, what causes stain on the teeth? So there's a lot of things that can cause stain on the teeth. The most common types of staining we see is usually coffee stain, tea stain, red wine, those kinds of things. And that's pretty common. Go ahead and close. And for my patients that get really heavy staining, I found if they start their mornings with pressed 3D white mouth rinse, it really helps prevent that stain from sticking to the teeth. So it's not so much for whitening, it's more to lay down a biofilm layer so stain can't stick to the teeth. So when you rinse with the mouth rinse in the morning before you have your coffee, before you have your red wine, your tea, whatever it may be, once you go to brush before bed, that stain's gonna come right off for you. So patients that I used to see with very heavy staining, we would spend most of the appointment removing that. Once they started using that mouth rinse, it's completely prevented that. So I find that's really helpful. Of course, if you have black stain built up already, coming to your dental professional and having them remove it professionally first is definitely what you'll have to do, because that stain is really sticky and stubborn. Smoking can cause to staining as well if you're a smoker. And if you are a smoker, that puts you at a much higher risk for gum disease as well. Go ahead and close. It basically cuts off the blood supply to the teeth and the gums, and everything starts dying because they're not getting those white blood cells to fight off all the bacteria and infection. So we always recommend, if you do smoke, quitting, finding a way to quit and get rid of that habit. Sorry, honey. Almost done with this part. Go ahead and close. Go ahead and close. And look at that, you have very little to almost no bleeding, which is awesome.
Thank
Really
you.
good sign.
Thank you.
I'm gonna give you a brush really quick. Go ahead and close. And open. And turn towards me.
Grab your assistant, see if she wants, you can get her opinion. Yeah, come on in, Dixie.
How would you make it slightly smoky?
So you can, potentially, do a little bit of this. Oh, perfect. Do a little bit of a stain on there. We're also adding that cement. The cement will actually give it a little, show it a little. Worst case scenario, you just decide to eat it.
And something else to ask your dental professional about, something we offer here, is laser therapy. Miss Muriel doesn't need it today because her gums look really nice and healthy. Everything's under control. But when we see patients and we see the deeper pockets, we see lots of bleeding, we always recommend a laser treatment. And that laser, what it does, it kills any tissue invasive bacteria I can't physically remove. So it's one of the best ways to decontaminate your gums, get all that bacteria out of there, and start new tissue growth so they can kind of regenerate and heal. So whenever you're at the dentist getting a laser treatment, whenever you have high counts of bacteria, lots of active inflammation going on, is always super helpful. Very painless, very cost effective, but very effective when it comes to controlling the gums and getting that infection under control. And then would you like to...
Hi, bro Shaka. Haven't seen you in a while. Welcome to my dental visit.
Would you like the fluoride treatment today?
No.
It's covered. Yep,
Yeah.
it's covered. And I have strawberry or mint?
Strawberry.
Strawberry, okay.
Bro Shaka. Bro, it's home care queen, bro Shaka. Am I not on my page? Don't tell me I'm on Facebook. You better be on my page. Okay.
You need a spit. Absolutely.
Love you too, bro Shaka. Love you too.
Okay. So last step is to put on the cavity protectant, the fluoride varnish. So we'll just paint that onto the front of our teeth here. Super important part of the caries protection. And you're just gonna wait 10 minutes before you eat or drink to let it set and dry. After that, you're good. Just no brushing until bedtime. Alright. Let's do it one last time. Go ahead and close. Alright. Everything feel good?
Yes.
Awesome.
This is so light. Okay, guys, so the process is over. The process is over. Up here, have your book up in there? Oh, bro Shaka, I know. Appreciate you guys. Appreciate you guys. I appreciate you guys. So the process. Do you know the person doing you? Yes, she's my hygienist. This is my regular dentist. This is my regular dentist office, so that's my hygienist. Yes, they're very, very good here. And normally it's, I don't know. I just when I come, I don't give it a time because they do such good work. Look at that.
Look at that beautiful smile.
Look at that. Look at that, huh? Look at these babies. As I said before, I only have one issue. These has to come out and replaced, but that's not, it's really not an issue. It was a concern that this area didn't feel well, so they found what the problem was. But look, look at my whiteys, guys. Bro Shaka. Bro Shaka, you see my whiteys? people are so funny. Welcome, welcome. Those of you who are viewing who are not in chat, I just want to say I welcome you. I welcome those in chat. I welcome Jackie Gross. Jackie, you're late. You have to pay a late fee. Jackie, you got to pay a late fee. So I just finished my diabetic oral care. Yes, they did. There's no problem that you can't get solved in this office. No problem. Okay, Jackie, you gotta pay a late fee, Jackie. There's no problem that you can't get solved in this office.
Are you ready to go ahead and check out? Or you
Mhm.
want to finish
I'm ready.
with your people glasses?
Thank you. Okay, guys, so I know a lot of you are just coming on. So I'm finished. All this stuff is because of the paste that's on the tooth to make it nice and
Yeah.
the fluoride. That's what's sticking here. Yeah. So thank you guys. Thank you guys. I know I missed you guys. Thank you. I get used to seeing you guys that when I don't see you, it's when they ask, you know who? Linda Charles. I haven't seen her in a while. That's just the fluoride, guys. That's just the fluoride. It does get dry. Yep, so that's my dental visit, guys. So thanks for spending the time with me. And remember, find you a good dentist. And if you're in the Scottsdale, Phoenix area, Scottsdale Dental Group is the place to be. Okay? So remember, take care of your oral health as well as your mental and your physical health. Thank you so much for joining me. Goodbye. Thank you. Thank you. Thank you. See you guys later. The Bike Festival was about a month ago. What do I plan for my hair? I haven't figured it out yet, but I think it's gonna be low. I think I'm gonna go low. I think I'm gonna go low. Yeah, I think I'm gonna go low. Where you going, Jackie? You just got here. I think I'm gonna go low for the hair. Yeah, I haven't figured it out yet.
Whenever you're ready, I can help you.
Yeah. I haven't figured it out yet, but I'm almost sure I'm gonna go low with some color. Yes, yes, okay.
I'll help you out on this side here.
Okay. Yes. So, this is prepping for my birthday, guys. Prepping for my birthday. So I'm gonna go to the hairdresser and I'm gonna cut it all off. Yeah.
Mira, did she schedule you for your next cleaning back there?
No.
Right. Did you want to get that
Three-
scheduled right now?
What is it, 3 months?
3 months, yeah.
Mhm.
So that would be in July.
Good. Thank you. Yes, my birthday is next Wednesday. Normally, I would be on my way out of the country, but this year, because of circumstances, I'm not traveling. So I'm gonna, when is it? It's next Wednesday, May 3rd. So I got the tooth done. I got the eye done last week. Now I got the tooth done. I got my EKG also last week. I'm tuning up this Jaguar. And so far, she's in good shape. So the next stop is to do something with this mess right here I call hair. That's the next stop. Do something with this mess I call hair.
Mira, any day or
Thank-
time?
Hmm?
Any day or time? Afternoon?
Yeah.
Okay. I could do July 27th. I do have a 2:30.
Okay. Thank you, Jackie.
Or I'm sorry, at 2 o'clock. Would that work?
Okay. Yeah.
Okay.
Thank you, Jackie. The fluoride is what's drying up on my mouth here, so don't pay it any mind, okay, guys? That's the
And
fluoride.
here's that for you. It's for that bridge that Dr.
Oh,
mentioned.
that's right, that's
Yeah.
right, that's right.
Did you want to get
So-
that scheduled?
Not yet. Let me go home and figure something out.
Oh, okay.
Yeah, but I could call and pay online and
Yep.
pay you on
Yeah,
over the phone, right?
Definitely. Mhm.
Okay, and then schedule. Is it a same day thing, or is it gonna take it off and rest the area for a while and then put it back on?
Yeah, so he will pretty much prep it and you'll come back in like a week.
Yeah, that's what I want.
Yeah.
Okay, that's why I have to check it where I'm gonna be.
All right.
Okay, thank
You're
you,
all
thank
set.
you.
Have a good one. Have a good birthday.
I like your
Thank
purse.
you, thank you. Yes, guys. So done with the dental visit. Oh, God, where's my keys? Yeah, so it's the speak proper patois. Sometimes I don't remember. Sometimes I don't remember. Sometimes I don't remember. Yes, yes, yes. I'm tired of doing it I'm tired of doing ponytails and I'm just tired. I promised myself that I wouldn't cut it off, but it's gonna be cute. Thank you, Jackie. Tell them, please, Jackie. Tell them. Tell them. I can't find my car keys. Tell them, Jackie. Share the love.
What do you want?
Bye.
Bye.
Ariel, you want your toothbrush?
Yes. Thank you. Because when I travel, I just throw them in the suitcase. Make life so much easier. Okay, guys. So I'm heading home. You all want to drive with me? I think I want to. I think. Angela, where you going? Yeah, what's proper patois? What's proper patois, bro, Shaka? Hmm? You want to drive with me? Okay. Did you love the bike show? Yes, the bike show was so good. And you know what happened? Hi, Karen. How are you? You know what's so good about the bike show? It's that it brings in a lot of money to the state, and it's very orderly. It's very orderly. Very orderly. Thank you, Jackie. Yes, I will be. I don't know. I need to go to the mall because I bought my birthday outfit and I wore it. I bought my birthday outfit and I wore it already. So I need to find something. I'm going to a concert, a gospel concert this weekend. And I have clothes, but you know, it's my birthday. I'm going to a gospel concert this weekend. Okay, all right, here we go. Here we go. Here we go. The only thing is when I go to the mall, they're gonna think my teeth is stained because they have the whitening on. And I can't drink or do anything for the next half an hour to get the whitening to really set. My birth, yes, Karen, I know yours is May 4th. My sister and my brother are twins, and theirs are May 4th. Mine is the 3rd. Mine is next Wednesday. Mine is next Wednesday. Thank you guys for the support. Thank you for the likes. Thank you. Mine is next Wednesday. Mine is next Wednesday, guys. That's why I'm out here doing the most. Getting my tooth done, and you know, I do it every 3 months. I go to the doctor every 3 months. My eye doctor, my dentist, I go to them every 3 months. Oh, your cousin is the 5th? Okay. Yeah, mine is the 3rd. Mine is the 3rd. Mine is the 3rd, and I'm looking forward to it. I'm looking forward to it. I will be 63 years old, Bro Shaka. Bro Shaka, I'll be 63. I'm so excited. I'll be 63 years old next Wednesday. I know, right? 3, 4, 5, pick 3, right? Trying to get the sun so I could see you guys. Yeah, it's next Wednesday. So Karen, that is so true. Karen, that is so true, Karen. The other thing is too, we are very loyal friends. We're very, very loyal friends until you prove otherwise. We are very, very loyal friends. Oh, thank you, Angela. Thank you, thank you. We are very loyal friends too. Until we prove otherwise, we're very, very loyal friends. May people are very low. We're straightforward. We're straightforward. We don't play games. And once you cross us, I sometimes I have to pray for the Lord to give me mercy, you know, and grace towards people, because they can be cruel sometimes. And if you follow them, you just cut everybody out your life, you know. But thank God I have a good circle of friends and family that I can trust and depend on. But for the wider public, we don't just. Thank you so much, Jeanette. Thank you. Thank you. I take pride in taking care of myself. I take such pride. Yes, straightforward and to the point. And we're not one of those people that you can easily love, because we don't play games. We're not hypocrites. You know, May people are not hypocrites. We're not one of those people that to love us is to love us. To love us is, I'm going to the mall, guy. No, I have friends. I was brought up in a big family, so because of that, I love companionship. So I have friends. But as I was saying, I don't know whether I should go local, or I should just go local to the mall, or jump on the highway, because the traffic is gonna be bad. I think I should just stay local. It's gonna kill my gas, but I'll just stay local. Yeah, we're very loving, very caring. We go hard for the people we love. We go hard, and when they hurt us, it stays with us, you know. When they hurt us, it stays with us. Miss Wendy, you're leaving? You're leaving, Miss Wendy? Princess Rose, you're still here? Thanks to those of you who are watching. I'm going to the mall. I just left the dentist, and I have some gift cards that I need to take care of them, because I have them since Christmas, and I need to use them. So since I'm on the road, I'm just gonna go to the mall. Yes, thank you guys. Thank you. I'm waiting till I get to I'm waiting till I get close to the mall to put the camera up, because Princess Rose is always concerned about me driving with the camera, but now it's in the holder. It's in the holder now, so I don't have to hold it. But as I get to the mall, I'll show you. This is a huge mall, guys. Huge. This is what they call a flagship mall, meaning all the high-end stores are here. So you guys are gonna love visiting this mall. Since I'm on the road and I'm so close, I decide to go there. because I have some gift cards that I need to use up. I didn't even remember I have them until I went into a new pocketbook that I wore since December and I saw them. Oh Jesus, did I take it with me? So as soon as I get close, where I'm a lot safer than where I am. Oh my God. But it's a beautiful drive. So let me share it. It's a beautiful, I'm taking the local street instead of the highway because the highway's got to be crowded right now. So it's a beautiful drive down there. Beautiful drive down there. Bro Shaka, are you still here? I want you to see this. Karen, you guys really love the views here. I'm heading down to, this is Arizona, Bro Shaka. Yes, the weather here is beautiful. And Bro Shaka, you asked me a few videos back, we don't have a beach here. Because if we have a beach here, we would go nowhere. It's so beautiful here. I should be working for the commerce department. Yes, it's a beautiful day. This is our summer. We're heading into summer. It's about 80, if I'm not mistaken, it's about 80 degrees today. Oh, it says 91. We're 91 today. Because remember, we're a hot state. We had a very, very cold winter. So because of that, we're going to be exceptionally hot this year, which is what happens. See the road? It's just nice and smooth. And this is not the highway. I'm taking the local all the way. I'm taking the local. It's more on gas, but the highway is gonna be so crowded. 91, that sounds like Jamaica. Yeah, the only difference is we don't have that nice wind. We have a little bit of breeze, but not like Jamaica. And then the other thing is, Jamaica, you can go under a tree. You can go, well, we go to the pool here a lot. Jamaica, you can go under a tree, you can go to the beach. Here we have a lot of pools. A lot of pools, and also we have a lot of what we call splash pads for the kids. I think when I went to the park last week Sunday, I showed you all the different things they have for you to cool down here. And most of the malls are indoors. Most of the malls are indoors. Those that are not indoors, we have what we call the mist. It just feels like a light rain on you as you walk. So they do everything to keep us comfortable here. And also, everything is central air. Everything. You leave your central air, you go in your car, you put on your AC, you go in a restaurant, you go to work. So, you know, I'm sorry for those construction workers out here. They mainly, I don't see a lot of them anymore. They mainly work early morning to mid-afternoon. And then for the streets, when they're cleaning them, they do it at nights. And the garbage men, they come pretty early. Yeah, the garbage men come pretty early. So people, you know, like anything else. I lived in New York for 30 plus years and it was cold and we survived. So, you know, when I first came out here, I never felt cold because I was so glad to leave the snow and everything. But it's a beautiful state to live and work, and you just make it work. Everything is, you know, about acceptance. This is where I choose to live, and I accept it. So I'm almost there because the traffic is not as bad as it would have been on the highway. It's not as bad as it would have been on the highway. See, people are waiting on the bus runs on this route. Not every area the bus runs in, but you know it's a mall. Okay. Okay, Karen. It's a nice place to visit. It's a nice place. And there are other parks that are really nice also beside that park. So I'm almost there and I have to watch, because if I make the wrong turn, I go on the highway going the other direction. Yeah, you guys can come up for a visit. We should plan it. Yeah, I have to watch where I'm going, otherwise I end up on the highway, because the turn to go to the mall, so I'm heading over there. I got here quick. I'm glad I didn't drive down to the highway. I got here quick because my doctor's office is close. Go ahead, do what you're doing. Do what you're doing. See? I got here very close, very quick. Yeah, so I'm entering the mall now. This is quick. I'm so glad I didn't drive down to the highway. This is very quick. And I tell you, they're building up down here so much. When I came here, it was just one way going in, one way coming out. And they're building it so much down here. So this is the Scottsdale Fashion Square Mall. One of the biggest mall in Arizona. Well, I don't know if it's the biggest, but people says it's the most expensive. I don't know if it's the biggest, because I think there's another mall on another area. I think Glendale has a big mall. So I don't know if this is our biggest mall, but I know it's one of the most beautiful malls. So I'm going under. If you cut off, I will come back on, because I'm going to park, and the parking is underground. The parking is underground. So if you cut off, just hang in there a minute and I'll come back on. Pray that I don't cut off. So this is where I'm going to park. And that's what I tell you. There's conveniences in everything. You're from Kingston? No, I'm from Ocho Rios. I think I'm from Ocho Rios. I'm from Ocho Rios, Broshaka. I'm from Ocho Rios. Yeah, so that's a good thing again about living here. I've never been anywhere where I have to park. Every parking I've been, it's free. I'm sure there are areas like when you go to the stadium to see the game and all that. But as far as shopping and dining, most places where we dine, they have valet service. Yes. I live in the tourist resort. Yes. Ocho Rios, yes. Most places here, when you go to eat, you get valet parking. They park your car, and when you finish, you just take it back, because the place is stamped. Also at the hospital, most hospital, you have valet parking here also. They just make it comfortable here. So I'm gonna go and wait until you all see this mall. I'm going to try, because I don't have anyone to rush home to. So I'm going to try. God, I hope my phone don't die. I should have plugged it in. And I bet you I didn't bring a charger with me. I should have plugged it in when I was driving, and I forgot. I should have plugged it in when I was driving, guys, and I forgot the phone. Yeah, I live in Ocho Rios. Yep, everything happens where I live. Everything happens where I live. I should have plugged in the phone when I was driving, and I forgot. I hope it doesn't die. And I don't know if I took the charger port with me. I need to leave one of those charger ports in my car. I hope I can find somewhere where I could charge it. So I'm gonna go in the mall now. And as I said, this is one of our Fashion Square is one of the malls that everybody talks about. It's a tourist attraction mall, I call it. It's a tourist mall. So I'm going in now. Going to try to find. I have clothes, so if I don't find anything, I know I should have brought it. I have it, and I left it home. And then I have the cord, but I don't have the thing that go in it. But there's so much places here. I'm hoping I can find one that when I was driving, I should have put the car to the phone to charge, and I totally forgot. And when I was at the doctor's office waiting, I should have put it to charge. But let's see how far I can go before it needs charging. I'm gonna see if I find a restaurant that has a charge. Starbucks should have a charger port that you just charge your phone. So let me try Starbucks. So I'm entering the mall. It is huge. I'm entering the mall. I have a portable charger, but I left it. I left it, guys. I left it. So this is a Monday evening. Normally you come down here. See? Normally you come down here and it is so crowded. Yeah, I have a portable charger and I forgot to bring it. Normally I come down here is so crowded. Sephora. See? Free People, one of my favorite stores, except they won't make clothes that fit me. They're so tiny. This is a Monday evening, so there's not a lot of crowd here today. Look at this. This is Scott Soma, yeah, Scott Soma. White House and Black Market. This used to be one of my favorite stores to shop, but I don't know what happened to them. I don't like their clothes anymore. I used to love White House and Black Market. Now this is the place. This is the place. Jackie Gross, Karen, all of you ladies. Look. This is the place. This is Soma. Soma. This is the place. I love Soma. Oh, Anthropology. Anthropology. Look here, guys. This is one of my fave. This is where I got my birthday dress that I wore. I bought it in December, but I wore it. So I don't want to wear it so fast on my birthday. This is Anthropology. They have the best of everything. They have the best of everything. But you know where's my favorite spot, guys? Let me take you, Jackie, let me take you all to my favorite spot. Let me take you all to my favorite spot. My favorite spot is the sales. The sales, you can get a dress in here from $300 to $99. The sale rack, that's what I specialize in, guys. The sale rack, see? That's what I specialize in, the sales. That's what I specialize in, the sales, guys. That's the first place I go. I love sales, especially on high-end clothes. Yeah, see? So I'm trying to find something really cute and chic for my birthday, and I found it in December. But as I said, I wore it. So I'm trying to win some age. Good evening, good evening, good evening. I'm at the mall. Yeah, Jackie, I'm telling you, when you come into these iron stores, you can find things from $300 to $99. Well, this is a Jamaica outfit. Look at that. This is a Jamaica outfit. Look at that back. I have this one in the blue. I have this one in the blue. Yes, when some, it wasn't 100, it was $300 for that skirt. I would buy it. Look. Look at this dress. This is so nice. This is so nice. And I'm going to Jamaica, you know, look at the birds on it. I'm going to Jamaica. I have to talk to my sister to see what date we're going. I think it's in June. June 27th we're going until July 10th, something like that. But I would buy it if I want it. If I want it, I'm buying it. That's how I am, Winston. I'm not responsible for anybody but myself. Yes, that dress is nice. That dress is nice. I'm going to watch the price because they have a sale here every 4 weeks. I'm gonna watch that dress. I'd love to buy that dress. I already have everything I need for Jamaica, but that dress is nice. That dress is really, really nice. So here is it, my favorite furniture store. I don't buy furniture buy furnitures anymore, but back in the day, this is where I go. Look at this. This is Z Gallery. This is Z Gallery. See, I'm just doing this for you guys because I am not shopping. I don't need anything. I have everything I need right now. Yes, Winston, I am going to. Because every 3 weeks they have a sale at this mall. So I'm going to because I love that dress. Even if it goes down to $90, it's $199 right now. I'm gonna watch it. But here's the thing about that. Sometimes when you go back, everything is sold out. The size you're looking for. I'm a 14. So sometimes when you go back for the sale, all the big sizes are gone. So this is Z Gallery. I'm just giving you guys a tour. This is not where I'm coming. I'm just giving you guys a tour. Everything you want for the home. I live for sale too in some. I couldn't tell the last time I bought something full price. Yep, I'm a sale girl. I love nice things, but look at this. Wow. Look at that. I love nice things, but if I can get it on sale, that's how I love it. So this is the mall, and as I told you, it's a Monday evening, so it's not crowded. I only came down here because I was in the area. Oh, you love it. I was in the area, so that's why I came down here. Yes. So let me go around. Everything you can find here, food, everything. Everything you can find is in this mall. See how big Starbucks is? This is the first time I came down here and the line is this short. So I'm going up. I'm gonna go upstairs. I cannot believe I forgot my portable charger. I'm gonna go upstairs. See, normally this smallest. If I'd come down here yesterday, I couldn't find space. Normally it's so crowded, but today's a working day. Normally when you come here, it is so crowded. It is so crowded. But everywhere is until about 5 o'clock. Because there's a movie theater here also. There's a movie theater. Here's this Victoria's Secret, but the secret is out. I'm not a Victoria's Secret person. I never was. The secret is out. I'm a Soma girl. Mac, here is Prada. Prada just came here about a year. Here's Prada. Prada, and you can't. These iron stores, some of them you can't go in until security guard let you in. Here's the Prada. Some of them you have to wait for the security guard to let you in. You can't just walk in. Because if one person is Dolce Gabbana, is another one that you have to wait to be let in. Because if they have 2 or 3 persons in there, you can't get in. You have to wait until those persons come out before you go in. And Versace. See Versace, I love this dress. It's just that they don't make them to fit real people. Can't fit in that unless you starve yourself for 10 years. Michael Kors. There you go, Michael. Michael Kors came out with that bag like, see that bag? Who has that bag? Coco Chanel has a bag just like that. And also, Marc Jacobs. Yeah, Marc Jacobs makes bag just like that also. Yeah. But I'm going down to, I'm either going to go to Tory Burch. Tory Burch, I don't think I can go in. They have 4 people in, so I'll wait till I come back. Because once they have 3 or 4 people in there, you can't go in there. You can't go in there, so I'll wait until I'm coming back. Marc Jacobs. See, all the iron stores are here. This is, see, the Michael Kors bag, the Marc Jacobs. Yeah, see that? I'm gonna. I'm trying to find my store that I want to go. I'm going to two stores. Jimmy Choo. There's Jimmy Choo. Again, these are stores that you have to wait for somebody to come out to go into. Kate Spade. I'm gonna go over to Kate Spade. I love Kate Spade's clothes. As I said, I'm looking for something for my birthday. Oh, look at this. Look at this, guys. Look at that. You guys like that? But they will never have my size. You guys like that? It's a little party-ish. Winsome, Janet, you guys like this? It's a little too party-ish for me. I don't want a party-looking dress. But look, guys, welcome, welcome. Those of you who are just coming on. I am at the mall. Look at this one. It's a little bit too party-ish, right? But it's my birthday. It's my birthday. And I don't know if they'll have my size. That's the thing. These iron stores tend to not have big sizes. Yes. Here's another one. But this is not for what I wanted for. I love the color. This is too much? I don't think this is too much. I think that's cute. I think this is cute. I don't like the poofiness. Oops. Oh, I'm so sorry. I'm using one hand. How much is it? I was looking for the price.
Yeah.
About 400?
$428, yes.
I know my prices if I like it. I know. Okay, so I'm not finding anything in here. I'm not finding anything in here. This is too much, right, guys? This is too much. So I didn't find anything in here. I thought I would, because I love their clothes. Look at this one. You guys like that? Okay, I'm gonna keep looking. This is the first stop I made because I love this store. Here's everyone's favorite store, Coach. Here's everyone's favorite store. See them? Everyone's favorite store, Coach. I'm not going in because I don't want to throw off their sales. Do you know that when you go into a store and you're not shopping, you throw off their algorithm? Oh, here's Dior. You throw off their algorithm, and sometimes they don't like it, especially this late in the evening. They're looking for a sale. You know, in the mornings they don't like it, but in the evenings, a store lady told me that in the evenings, here's Cartier again, Cartier again. Can't go in once somebody's in there. You have to wait for them to come out. But I'm heading into Dillard's because they sell some really nice dresses. So I'm heading into Dillard's. Thank you guys for journeying along with me. Thank you, thank you. I'm going into Dillard's. Karen, you are not there? Estee Lauder, man, I tell you, I love Estee Lauder. When I got married, I gave everybody a knowing. I gave everybody a knowing when I got married. Oh, Winsome is coming on now. I guess that's why everybody left. Winsome is coming on now, I see. Winsome is coming on. Okay, see, Dillard's, they have really, really, really nice designers. Really, really nice clothes. So, I love coming here. I love coming here. They have really, really nice clothes. Michael Kors. I don't think I want a Michael Kors this year. I have so much of them. I just want something nice and chic, elegant. You know, 63 is a big deal. 63 is a big deal. Look at that. But I need to find, there's a special area. Karen Kane. I don't know if it's me, but I noticed that the clothes look so frumpy lately. Is it me, or do you all notice that too? The clothes look so frumpy lately. I don't know. They don't have any to them. Is it me? Look at this. Everything looks so maiden. Look at that. These are what coming out for the summer. These type of big, everything is big now for the summer. Everything is big. Everything is big for the summer. No, I don't want dresses like that. Everything is big now for the summer. Everything I see is so big. Look at that. That's too frumpy. That's too frumpy. I'm looking for, well, that color doesn't look bad. You like that? Everything looks so. So guys, my phone is going down because I forgot when I left home for the dentist. I forgot to take my charger with me. So thank you all for journeying with me to the mall and to the dentist, and I will catch you guys later. All right? Thank you, thank you, thank you.